Welcome back. In this video, I'll teach you everything that you need to know about how calcium affects the heart and what are the ECG changes that we see. We'll talk about the symptoms, the causes, and of course the treatments. We'll start with hypercalcemia, in which we will see a short QT interval. This is very characteristic of hypercalcemia. You will also see the infamous J wave, also known as the Osborne wave, and there will be QR prolongation and PR prolongation. I like to think of it as someone's trying to stretch the ECG and everything is stretched. So there will be prolongation all over. But the QT interval, which is one of the largest voltages, will be constricted trying to overcome this spreading or this stretching. So you will have prolongation all over except in the QT interval, which will be shortened. The causes of hypercalcemia are very, very important. You should know them because you will see them everywhere in the clinical practice and in your exams. One of the most important causes is of course hyperparathyroidism. This can be either caused by parathyroid cancers or nodules. And it can also be caused by a wide variety of cancers, as cancer can activate vitamin D and can cause granulomas, which can also activate vitamin D. There are also some hereditary factors. Immobility or crush syndrome can cause hypercalcemia, severe dehydration, and some medications. The symptoms are mainly bony pain or bony symptoms. So the patient will complain of symptoms in the joints, like major joints, especially the knees, the hips, and the shoulders. And the pain will be deep-seated, deep within the tissues. They can also have fatigue, headache, nausea and vomiting, constipation, which is very important, decreased appetite, altered mental status, characterized by irritability or depression, and increased urination and thirst. There are a wide variety of medications that we can use which will decrease the calcium levels, mainly calcitonin. It's simply an analog of a natural hormone that naturally decreases calcium levels. But it's often very ineffective. So we can use calcium mimetics, which work on the parathyroid gland, the bisphosphonate drugs, which are very commonly used, denosumab, prednisone, and we can simply give IV fluids and diuretics, which is the first-line treatment actually. Now let's talk about hypocalcemia. The main characteristic of hypocalcemia is simply prolongation of the QT interval. Very rarely you'll see a patient developing torsade de poids. The main causes are deficiency of vitamin D, hypothyroidism, mainly after surgeries such as thyroid surgeries. And keep in mind, hypothyroidism can develop after thyroid surgeries whether or not the surgeon have accidentally excised the parathyroid glands, as simply manipulating the parathyroid gland causes them to be malfunctioning for a short period of time. Which is why we give all patients after thyroid surgery some calcium pills. And of course, renal diseases, as the kidneys are very important in activating vitamin D and they play a major role in calcium homeostasis. For the symptoms, think of tingling around the lips or the hands or feet, muscle pain or muscular problems like spasm in the muscles or twitching in the hands, stiffness in some muscles, especially the fingers or the small muscles, and in severe cases, seizures. Calcium has to be corrected slowly, so if a patient has chronic hypocalcemia, it should be corrected slowly by smaller, gradually increasing doses over time. But if a patient has acute hypocalcemia, it can be corrected with large dose of calcium. Again, this can be given either intravenously or orally. Our ECG course contains all the changes that can occur in an ECG, and it helps you become an ECG expert, so that you can recognize any ECG that you might come across. The course contains everything that might affect an ECG, all the symptoms, the causes, and of course the treatments. It also has plenty of quizzes to test your knowledge and make sure that you cement these informations and be able to answer any question about an ECG. You can access the course using the link in the description or in the pinned comment.